evening and welcome to the COVID-19 update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. As states in Nigeria battle to flatten the COVID-19 curve, we take a closer look at the regional numbers and what they mean. Taraba State government intensifies contact tracing to contain spread of COVID-19 in the state. And U.S. health officials signed contract with pharmaceutical giants to buy 100 million doses of their coronavirus vaccine once approved for use. Now, from the Nigeria Center for Disease Control (NCDC), 344 persons have recovered in the last 24 hours in 13 states past the Federal Capital Territory. Kaduna recorded the highest recoveries in 24 hours, discharging 59 in total. However, according to the government, 20 samples returned positive out of the 108 tested. The new cases are from Chikun, 11, Jema, 7, and 1 each from Kaduna South and Kaduna North. There were more recoveries in states like Osun 56, the FCT 41, Plateau 37, Rivers 36, Lagos 29, Bayelsa 21, Edo recorded 20 recoveries, 14 in Ogun State, 11 in Enugu, 8 in Borno, Delta recorded 4, same in Imo and also Oyo State. Now, states in the top 5 in terms of the highest recoveries are Lagos. It has recorded the highest patients that have been discharged at 1,993, followed by Edo State, 1,300. Kano is at number 3, discharging 1,125. And 1,120 persons have recovered in Oyo State, Southwest Nigeria, and Rivers is at number 5, having discharged 1,039 cases. Now, total recoveries in the country stand at 15,677, with confirmed cases totaling 37,801. In the meantime, 805 deaths have been recorded in 36 states and the Federal Capital Territory. And in the meantime, over 748,000 confirmed COVID-19 cases are on the African continent, with more than 409,000 recoveries and 15,000 deaths. Well, let's move over right now to the figures. I mean, when coronavirus numbers in Nigeria are mentioned, attention most times on the total confirmed cases, which currently stands at 37,801. And so we were to begin, we're looking at the total confirmed cases, the recoveries, and the deaths. But today on the program, we'll take you through some of those figures that may be the most important in drawing the conclusions as to whether or not Nigeria is on her way to flattening the coronavirus curve. When we look in percentage terms, 56.4% are the active cases in Nigeria. And in terms of those that are confirmed, the total confirmed cases, you have 41.5, and the other ones that have recovered. And then the death toll at 805 represents 2.1% in terms of fatalities. Now, looking more at the report so far, and this is a report coming in the northern part of the country. You have the figures from the north central, the northeast, the northwest, and in total, the total confirmed cases stand at 11,320. You can see the number of deaths in each of the regions, those that are active, and of course, the recoveries that have been made so far. It's also similar to when you look at the breakdown in the southern part of the country. You have the numbers of recoveries from the southwest, states in the southeast, and also states in the south. You can also see the total number of deaths, and you find that at 494 deaths have been recorded in the southern parts of the country alone. Active cases stand at 16,844. So when you compare this figure from the south to that of the north, we have, of course, higher figures here in the south, totaling 26,481. Now, more about all the figures we're seeing, the confirmed cases, going by the numbers in the northern, southern parts of the country, and those that have been treated and also discharged, you see that the survival rate in the north gives us 57.72%, while the south about 34.53%. So people are wondering, is this really the figures? Can we go by this data we're getting when we look at cases in the north, cases in the south? Why indeed are they increasing, and perhaps what region doing better than others? Well, let's find more about the factors behind the figures. A public health physician, also an epidemiologist and retired director of disease control and immunization at the Primary Healthcare Development Agency, Dr. Emmanuel Abanida. He joins us from our Abuja studios. Thank you so much, Doctor, for joining us on the program. What do these figures tell you?
Thank you very much. Well, the figures are there, and as we have said, they are figures. But I think we have to look at these figures within the context of standardizing what goes on in the north and in the south. If you are testing one per perhaps maybe 10,000 people in the north, and you are testing one per 5,000 people in the south, obviously the figures will be slightly different. I want us to be circumspect about these figures because we have not achieved the optimum testing rate. And if we look at the entire country, we found out that about 20% of all the cases that are tested have become positive on the average in the past 3 months or so, and an average of between 40 and 45% of all the cases that are positive have recovered from the disease, and we're having a mortality rate of between 1 to 1.6% as occurring. I think dividing it to north and south may be misleading, because are we testing the same number of people per unit population in the south or in any state in the south compared to testing the same number of people in the north by the same population? Nigeria is testing an average of about one person per 1,500 people, which is extremely very low as compared to a country like South Africa that is testing about one person in 36 people. So until we are able to ramp up and we achieve an optimum number of testing either in the south or in the north, then we cannot have a comparison. You cannot compare two quantities or two data that probably don't have the same denominator. That's my take about that. I think we need to be a bit circumspect about this consideration. Let us know that on the whole in the country, we have a test positivity rate of about 20% on the average, recovery rate on the average of 40%, and the case fatality rate of about 1 to 2%. And that has a lot of implication for the national figure if we are going to look at it globally, nationally. What it means is that
Dr. Abanida,
perhaps maybe about 20% of Nigeria, we test about 200 million people, Nigerians, about 20% of us will be positive. And you may have about 40% of those that are positive that may recover and may have a case fatality rate of about 1 to 2%, which represents perhaps maybe about 4 million Nigerians out of about 40 million Nigerians that may recover. And these are the figures. I don't want us to say the north is this, the south is this. There are states in the south that are behaving exactly like the states in the north. And
I must quickly ask you, and this is if you can respond in just a few seconds, because we need to go, and that is there a possibility that if the curve in Lagos, which is the epicenter, is flattened, we're closer to bringing down the national COVID-19 curve in total?
Well, if you say the biggest burden appears to be in Lagos, and if we have an event that is bringing us to a positive trajectory in Lagos, certainly it is going to affect the national figure. But let's forget that what is happening in Lagos is in Lagos. And then we are talking about this COVID, we are talking on state-specific. We cannot transpose exactly what is happening in Lagos in terms of outcomes to what happens in another part of the country. It's just an example for us to see what's happening in Lagos and see what lessons are going on in Lagos. How are they flattening the curve? What are the responses they are giving to cases that have been detected or those who are positive? What's happening in the isolation center? And what is happening in home care that is now becoming the crux of the whole thing? It's
We'd like
good
to
that
thank you.
Lagos is making a lot of efforts, but we also know that there are a lot of intense community
Mission
transmission
that's
going on
ongoing.
in Lagos.
Thank you so
Far
much.
more than any other country. Yeah.
Thank you so much again, Dr. Emmanuel Abanida. Thank you so much, epidemiologist. Thank you for joining us on the program. Now, the Taraba State Technical Committee on COVID-19 says it has intensified community contact tracing of persons who have come in contact with the patients they have at isolation centres. The chairman of the committee, while briefing journalists on the update of the 24 new cases, disclosed that there are cumulative cases of samples sent since 2 weeks ago.
We have commenced active case search in the community because currently we have tested over 500 samples. And if you look at it statistically, we are having barely 50-something confirmed cases in Taraba State as against the 500 plus samples that we have tested. And if you look at the statistic nationally, Taraba State and a few other states are the few states that have less than 100 number of confirmed cases in the country. We are working hard to have a testing center in Taraba State. When we have a testing center, we are likely even to see more cases because the pandemic is still ongoing, and this is just the first wave of the pandemic. It has not reached its peak because there's a lot of community transmission. And out of the 24 positive samples that we saw, most of them were contacts of initial people that were tested positive. So when they follow up their contacts, they also were positive.
Dr. John Oladijo, Director, Health Emergency Preparedness and Response Department with the NCDC, joins us on the program from our Abuja studios. Thank you for joining us at this time. I'd like to begin by asking the latest high-profile person to contract the virus, the governor of Ekiti State. Now, in that case, where and when would we say that the virus is occurring or that it did occur? Are we having a rise in cases? And this is because people are not adhering to the preventive measures.
Very much. As a matter of fact, we are now having what we call community transmission because most of our people, they are not actually adhering to the guidelines which were actually set by the federal government, that they should be using the face mask, there should be social distancing, and they should be washing their hands regularly. So most of our people in the community, they are not actually adhering to it. You know, if you go to some bar, you realize that most of the people that are just walking on the street, you don't see them, wearing the face mask, and then you see people gathering in the evening, over some bottles of drinks. So all these are actually, making the number of cases to rise on a daily basis.
All right, looking at this and perhaps, other high-profile cases, the question really is how easy is contact tracing? And this is to isolate the cases, make sure that, there isn't a lot of the cases in the community.
Oh, thank you very much. The NCDC provided some guidelines on this. We had a strategies which has been disseminated to the states and the local governments on how to really conduct a contact tracing. More than 200 community volunteers have been trained in each of the states, and our rapid response team, they are in all the states of the federation, and what they are actually doing is to support the states on how to really ensure that we reduce the number of cases, and then we ensure that all these the guidelines that have been provided are actually followed. You will recall, that initially it was only the people that are coming from outside the country that are actually importing the cases. Then after some time, these people are mixed with the native, and this number of cases are just increasing. And in view of this, the Nigeria Center for Disease Control actually developed guidelines, developed a 4 topical strategy that we're actually using, and we are actually providing fund to all the state of the federation. That is the federal government, giving funds to all the state of the federation. And we have what we call IAP, that is Incident Action Plan, which were actually developed by the states in support of the partners at the federal government. So this IAP contain these activities that are going to be executed in the next
to support the
couple
states.
of weeks. And this will now improve contact tracing. It will also, improve the strategies of ensuring that we contain the disease in no distant time.
We'd like to thank you.
Say that there will be flattening of the door of the
curve.
So
thank you so much.
Are what we're actually planning to do.
Dr. John Oladijo, Director, Health Emergency Preparedness Response Department with the NCDC. Thank you for your time.
Thank you very much.
We'll have more on the COVID-19 updates when we return. Stay with us. Welcome back. As part of measures to ensure that students stay informed during the COVID-19 pandemic, the Ebonyi State government has disclosed plans to commence a virtual education technology system across the state. According to the state's Commissioner for Education, Mr. Onyebuchi Chima, at a briefing in Abakaliki, the Ebonyi State capital, the program will continue to run until it is safe for schools to reopen. Now, we understand that Dr. Ezen Umeh is a GP registrar at Worcester Royal Hospital, England. He joins us via Skype. Good to see you, Ezen. We understand that health experts in the UK have told politicians that the SARS-CoV-2 virus will be with us for decades. Have things become better on the front line?
Thank you very much, Millicent. Once again, things have become better on the front line. And in the United Kingdom at large, we've seen life restore or go back to normal. We've seen restaurants, shops, we've seen public places open and people carrying out their normal day-to-day activities. And so we can see that things are getting better in the UK. And in the front line, we've seen significant reduction as regards to the number of coronavirus cases that we see in hospital, as well as the coronavirus day-to-day deaths that we record in the United Kingdom. So today we've recorded 79 deaths in the United Kingdom, which is lower than yesterday, where we had 110. And also in Scotland, which is one of the devolved governments in the United Kingdom, this week recorded the lowest death toll in Scotland since March. So yes, things have been indeed going very well, and they are getting better. And then finally, on that note, there is advancements in terms of the coronavirus vaccine, and so things look bright currently.
So in terms of what has been done and why you're seeing the flattening of the curve, what would you say they're getting right? Would you say the government is getting something right, or the people are adhering to the non-pharmaceutical measures to protecting themselves?
Well, I would say it's a combination of both, to be honest. At first, there were lots of talks that the government were slow in reacting to the pandemic. But, at some point, they began to get it right. They were able to pump a lot of money into the NHS in terms of providing personal protective equipment, providing ventilators for the NHS. And the people, on the other hand, have done their part. And they stayed at home when they were told to stay at home. And of course, they are out on the streets now that things look a little bit, better. So I would say it is a part of the government. They've done their part by providing and boosting the health sector. And the people have also done their parts by adhering to government instructions.
So much excitement about the prospects for the Oxford vaccines. Already we hear countries are ordering even before the third trial is concluded.
Right. So the University of Oxford have just announced a major breakthrough in terms of their clinical trials for the coronavirus vaccine. And it's shown that this vaccine is able to initiate immune response that can neutralize the coronavirus. And that's a major step, in the fight against this pandemic. Out of the 1,700 participants that were used in this phase 1 and phase 2 trial, 91% of them were shown to develop antibodies. So antibodies are those things that are able to recognize the virus if you've been either vaccinated or you've been infected, such that you cannot be reinfected again, because they would recognize and fight against this coronavirus. So 91% were able to develop antibodies after the first dose, and 100% developed antibodies after the second dose. So that's a huge step. There's still lots of unanswered questions as to whether these vaccines will provide long-term immunity, and there's still a lot of grounds to cover as regarding this clinical trial. So the next phase of this clinical trial will see this vaccine being tested on thousands of people to see how safe the vaccine is, and also in areas where infection rates are even higher, to see if this vaccine can help people who get this infection naturally. So yeah, we have made a feat in starting the vaccine clinical trials and coming to this point. But yes, there is still some grounds to cover.
All right, we appreciate your time. Thank you so much, Dr. Ezen Umeh, GP Registrar, Worcester Royal Hospital, England. Thank you for joining us.
Very much.
US health officials have signed a contract with pharmaceutical giant Pfizer BioNTech firm to buy 100 million doses of their COVID-19 vaccine once it's approved for use. Health Secretary Alex Azar said the production would start in December and that the country could acquire a further 500 million doses. Here's more on our global update.
Australia has imposed compulsory face mask wearing for residents of the second most populous city, Melbourne, starting today. Following the record number of cases in the country, much of the over 500 new cases were recorded in the Victoria State, of which Melbourne is the capital, with 484 cases. Hong Kong has also reported its highest daily total yet, with 113 new cases. Of those, 105 were local transmissions. The city has seen a rise in the number of cases in recent weeks. Over in South Africa, restaurant owners and workers in the tourist areas, including Cape Town, are holding peaceful protests against the government's reimposed curfew and a ban on sale of alcoholic drinks.
Our website, channelstv.com, has the latest updates on the pandemic. All you need to do is log on, access the news in health. There's several other stories coming in from around the world on other issues. You can see our top stories. Scientists report the airborne COVID-19 is probably infectious. You like to take a closer look. You want to take a closer look at that story and others. channelstv.com. That's the COVID-19 update on Channels Television in collaboration with the Ford Foundation. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe.